Good afternoon, everyone. On behalf of RBVRR Women's College of Pharmacy, I, Zinat Banu, working as Assistant Professor in Department of Pharmacology, feels privileged to extend my warm welcome to all presented here for the webinar on cancer awareness as a part of World Cancer Day celebration. Every year, World Cancer Day is observed on February 4 to raise awareness of cancer and to encourage its prevention, detection, and treatment. The primary goal of World Cancer Day is to significantly reduce illness and death caused by cancer. This year, the theme of World Cancer Day is Close the Care Gap. The main aim of the initiative is to motivate, reform, and inspire action even after World Cancer Day. As a part of World Cancer Day celebration, RBVRR Women's College of Pharmacy organized three virtual events, including a fitness challenge, an illustration competition, and a webinar on cancer awareness, all of which have received good responses. It's my pleasure to invite our principal and convener of this webinar, Professor M. Sumakant Madam, to share a few words on World Cancer Day. I welcome you, ma'am.
Thank you, Gina. It's my honor and it's my privilege to welcome today's speaker, Dr. Archana Garu. And I extend my warm welcome to all the participants registered as well as our students and the faculty. Good afternoon to one and all. Uh, Cancer Day, you can't say that the day itself, it's a continuous process, awareness. So awareness is plays a major role in early detection of the cancer. So not only in cancer, even if you take silent killer, another disease, BP as well as diabetes also, we need to have the continuous awareness programs. So these awareness programs help us for early detection as well as the better treatment also. But we can't compromise with one day cancer day, but you have to continue this throughout the time, not in a year or in 2 years. So it is a continuous process. So this cancer, it doesn't have any differentiation whether it is the developed country or the developing country. If you see in all countries, the name is same, cancer. So the rate is also very high in all countries also. But the awareness, I think in India it is still at poor condition only. uh, we need to improve that rate of awareness programs in India. So when compared to the other countries, our population is very high. So with this population also, we are making somewhat better only, but still we need to improve our awareness programs. So these awareness programs are mainly to focus on three aspects. One, we have to say that we have to aware the people what are the different causes, how you can avoid to exposure for these causes. And another one is what are the risk factors involved in this, and how can you detect sign and symptoms of this disease, and what extent you can avoid the conditions where you can avoid which are responsible for causing this cancer. So whatever the awareness program which we are conducting here or there, everywhere the awareness should include all these factors. We have to educate the people about these signs and symptoms as well as the causes, and how can you prevent to expose for these causes, and what are the risk factors. So most commonly this in this field, breast cancer, cervical cancer, ovarian cancer, prostate cancer. So not only these things, for every organ it is affecting. So this is the I think a unique term we can use it. Unidentified disease, like it is cancer only. But we don't know exactly how you can identify this cancer. But unknown reason which we are getting this, we are naming this as the cancer. So these awareness programs are helping a lot to reduce to report at later stages. They are helping a lot in early stage detection. So with this early stage detection, I think the treatment is succeeded in overcoming these type of diseases. So with this, I am here concluding, and once again, I welcome all the participants. Thank you.
Your thoughts. It gives me immense pleasure to introduce the speaker of the day, Dr. Rachana Chinnamaneni. Ma'am received her MBBS degree from Pratima Institute of Medical Sciences, MD degree in General Medicine from Chalmida Anandrao Institute of Medical Sciences, and DM degree in Medical Oncology from Nizam Institute of Medical Sciences, Hyderabad. Coming to her professional experience, Madam is presently working as Assistant Professor at Department of Medical Oncology, Nizam Institute of Medical Sciences, India. Earlier, she worked as Duty Medical Officer in Internal Medicine Department in Kamineni Hospital, Hyderabad. Ma'am is awarded with Dr. P. Shivareddy Gold Medal for securing highest marks in ophthalmology by Dr. NTR University of Health Sciences. Ma'am has about 13 scientific publications in prestigious national and international journals. In terms of her social contribution, Ma'am took part in a number of public cancer awareness programs. At many institutes, Ma'am conducted breast cancer and cervical cancer awareness campaigns. With this brief introduction, I cordially invite Dr. Rachna Chinnamaneni to deliver her talk on the topic cancer awareness. I welcome you, ma'am.
Good afternoon. Thank you for the kind words and thank you for giving me this opportunity to speak something about cancer and increase the awareness about cancer among all of you. So, yes, as she told, I'm working as the assistant professor at Nizam's Institute. And as the principal ma'am was saying, yeah, it is not a single day that cancer is present. Cancer is there every day. It is a continuous process where everyone has to be aware of it. Everyone has to be careful and cautious about identifying the cancer symptoms and getting it treated. So a few slides, and I actually want to know if it is possible for the question and answer session, because that's what I'm would be happy to answer any queries which you have instead of me speaking monotonously. If any possibility is there, I would invite all of you to post your questions in the chat box, which I can answer.
Ma'am, at the end of the session, you will be getting
Yeah,
the
okay.
questions.
Okay, sure. So I'll try to speak as soon as possible so that I can take more questions in the time we have.
Yes, ma'am.
Can we start the slides?
Okay, ma'am.
Yes, ma'am.
Yes, please. The next slide, please.
Yeah.
So this is what all we are going to discuss today. So I want to ask, I mean, most of us, we all know that we might have met some cancer patients in our family or friends, or some distant relatives might be speaking about a cancer patient, or we might have seen some cancer patients. So the first question which we get is, what is cancer? Next slide, please. So what we think when we hear the word cancer, we think, what is cancer? Why does it come? These are the common questions which even our patients, when they come to meet us, they ask these questions only. So why does it come? What is the link between family, genetics, and cancer? Could we have done something which can prevent the cancer? So these are the common questions which we are faced day in and day out, and these are the common questions for everyone out there. So next slide. So broadly speaking, it is a broad group of diseases involving the unregulated cell growth. So cancer is not limited to any part of the body. It can occur at any organ you can name in your body, starting from the skin to your GI tract, your CNS, your brain, everything can be involved with cancer. Next one. So if you can see, when the brown lump kind of thing which you see is actually the carcinoma or the cancer. So the normal cells, instead of having a normal proliferation, that is normal division and maturation and death, they keep on proliferating only. There is no death for cancer cells, so they keep accumulating, and this results in formation of a cancerous tumor. And once the tumor becomes to such a size that it cannot be contained in that particular site, then it will start moving around into different parts of the body. This movement is mainly through the bloodstream. That is, the cancerous cells from their primary site of origin enter the bloodstream, and from there they go to different organs. And depending on the primary site of the cancer, the metastasis also varies. Suppose if you have a breast cancer, it can most commonly go to the bones and liver. If you have a brain tumors, they generally spread to the spinal cord again. And if you have a lung cancer, it usually spreads from one lung to the other lung, or it can spread to the adrenal system. So depending on the primary site of the cancer, the site of metastasis, that is the site of spread, is also different. Next one. So this is how the cancer cell travels along with the blood cells in the blood and goes to the different sites. Next one. So what is the present scenario? Cancer is not a small disease. We generally keep hearing that diabetes, cardiac diseases are more common, but yes, cancer is also as common as these diseases. It is actually responsible for 20% of all deaths happening in the world. So every year, nearly 11 lakh new cases are detected, and 7.8 lakh patients die only because of cancer. So the magnitude of problem with cancer is very high. It is something which can never be neglected, and it's something which requires a lot of awareness and lot of work to try to control the cancers also. Next one. Next, please. So I would be speaking some facts and also some myths. 90% of the cancers, patients generally ignorant at the early stages. They find some abnormality, but they ignore it. They consider it as, they try to find reasons for their abnormality. They say the weakness is because they have been traveling for the past 2 to 3 days. The breast lumps are maybe because of the lactation, that is the milk cysts are forming in the breast. It is not cancer. They give some or the other reason. They try to find some or the other reason to say the abnormality in their body is because of that some reason, but not because of the cancer. So they try to be as ignorant as possible, and they try to avoid coming to the doctor and getting tested with the fear that they may be diagnosed with a cancer. So this is what we have to avoid, because if we detect cancer in the early stages, it can be cured. And cure is something which is very, very important for a cancer. When you say cure, you mean that the patient is not going to be affected by cancer again in the future, and the person can have a normal lifespan as a person who is not having a cancer. So cure is very important, and for cure to happen, we have to detect the cancer in very early stages. Next one. So yes, as madam was saying that it's not only for a developed country or a developing country to have cancers in their population. In the same way, it not only affects the normal people. Lot of celebrities have been affected with cancer. These are few of the celebrities which we all know, who have come openly with the diagnosis, who have given us this with the treatment plans which they have undergone. How did they face the cancers? And actually, these people are very inspiring to most of us. There is nothing to hide in a cancer. It is nothing a mistake which you have done to get a cancer. So hiding it or keeping it a secret and not getting treated is going to affect your own health rather than someone else's health. So yeah, I request all of you that celebrities are also a kind of inspiration in such situations, where they come out openly, speak about their health, and also try to create awareness among public that yes, cancer can affect anyone. It's not limited to any particular group of people. It can be present everywhere and at any time. Next one. So what are the causes of cancer? Next, please. So basically, I can't, or no oncologist or anyone can point out that this is the particular cause for cancer. General idea behind the causation of cancer is that usually there may be some defect in the genetics. The genetics may load the gun, but the environmental factors, the lifestyle which we have, and the environmental effects will pull the trigger, and both of these together will lead to the development of cancer. Next one. So these are some of the common causes which have been identified by various studies to be associated with the increased risk of cancer. The most common of them is tobacco, followed by additives in the food, alcohol, exposure to sun, and sometimes like female genders are more prone for developing breast cancer. These are few causes of cancer, but yes, I'm not saying that all of these will result in cancer. So next one. So cigarette smoking, we all know, we keep on seeing this in all the movie theaters before any movie starts or everywhere. Yes, cigarette smoke contains 7,000 deadly carcinogens. Next one. So when the cigarette, not only the cigarette, but any tobacco product, when it contains so many carcinogens, it is bound to affect different parts of the body. And these are all the different parts of the body where the cancers can occur because of tobacco use. So starting from your oral cavity, that is the mouth, to your vocal box, your lungs, your kidney, your uterus, your urinary bladder, anything can be affected because of cigarette smoking, and any cancer can occur in those patients who are addicted to tobacco. Next one. So I was saying not just cigarettes, but using BD chuttas or using the pan and using crane, the betel nut powder is also harmful because betel nut chewing, chronic betel nut chewing can also result in oral cavity cancers. Next one. Then coming to alcohol, alcohol is no less than smoking. It also is associated with various cancers, but yes, I would say the number of cancers associated with alcohol are less, but nonetheless, it is not a good habit. It's a very bad habit to be addicted to alcohol and have consuming alcohol in a chronically and in a higher quantity than which is normally recommended. So the cancers associated with alcohol intake are the mouth, that is the oral cavity cancers, the esophageal cancers. Breast cancer is also associated with increased alcohol intake. Liver cancers and the intestines, that is the bowel cancers, are also associated with the intake of alcohol. Next one. So other than smoking and alcoholism, even increased obesity. Then increased obesity is mostly commonly associated with the development of the breast cancer and colon cancer. So people who are obese have a higher propensity to develop cancer. Next one. So this is a picture which shows us the link between being physically active and not being physically active, and those people who have a uh, increased fat in the body, that is obesity. It is not the healthy fat, but it is the BMI. If more than 35, then we call it as obesity. And so those people who are obese have a higher risk of developing gallbladder cancer, kidney cancers, colorectal, breast, pancreatic, endometrial, and ovarian cancers. Out of these, breast and colon cancers are highly linked to obesity. Next one. So one more question we commonly face is that we have someone in the family who has a cancer. Are we going to get it? Or we don't have anyone in the family with cancers, but still, why did we get this cancer when it was not there in the genes? So yes, not all cancers are hereditary. Most of them are not inherited. Only 15 to 20% of the cancers are seen in the families, and out of this, only 5 to 10% are inherited from the parents or the relatives. So the common cancers which are known to be familial are the breast cancer, the retinoblastoma, that is the tumor which affects the eye, especially in children, and the colon and ovary cancers. These are the common cancers which are seen in families. But yes, not all of these are also present in the families. Only certain genetic mutations are associated with the familial occurrence of these cancers. Next one. So those were the causes which we have been thinking that this might be leading to cancer. It's not that all obese people will develop a cancer, or it's not all smokers will develop cancers, but yes, they're at higher risk of developing cancer. So what are the symptoms which we need to look out? What are the features which the cancer presents with? Next one. So generally speaking, symptoms of cancer can be any unexplained change in your body, sudden changes in your body, sudden appearance of any lump anywhere in the body, changes in the bowel habits, that is, you are having constipation for 2 or 3 days, then you have diarrhea for 2 or 3 days, and it keeps changing. Your regular bowel habits are changed, and you might be noticing a lump in your breast. Or if you think of a lung cancer, there could be coughing, chest pain, or breathlessness. Or there can be chances of bleeding, sudden unexplained bleeding without any injury or anything, sudden unexplained weight loss, blood in urine, or presence of any moles. That is, the mole size is increasing, or change in color of the moles, or number of moles are suddenly increasing. Next slide. So I'd say of the common warning signs of the common cancers. Oral cancer is the most common cancer in men in India, and it is also one of the topmost common cancers in India. So what are the signs of oral cancer? There may be sudden development and persistence of a white or red patches on the tongue or on the inner side of your cheeks, on the mucosa. Or there can be sudden any swellings over the gums or below the teeth or on the tongue. Or your tongue is fixed and you're unable to move it properly and you're unable to speak properly. There is a difficulty in swallowing or difficulty in drinking water, which is persistent for more than a week or 10 days. Or there may be ulcers, that is small injury kind of thing, or ulcerations over the mucosa which are not healing. Normal ulcers which we develop because of nutritional deficiencies will generally heal within a week or 10 days, but these cancerous ulcers do not generally heal. And also difficulty in opening your mouth completely. There will be a restriction of your mouth opening which is not normally present. Next one. The next cancer is the laryngeal cancer, that is the vocal box cancer. And this usually present with a persistent hoarseness of your voice, not the hoarseness which you see because of your sore throat, but this persists for longer time. There is a soreness, persistent soreness in the neck. You might be feeling a lump in your throat, and there is a difficulty in swallowing. Next one. Then we have the lung cancer. The most common symptoms of lung cancer are cough, coughing out blood, but all coughing out bloods are not cancer. So don't worry that if you have once a streak of blood in your cough sputum, doesn't mean that you have cancer. But yes, if it is persistently present or you have coughing out lots of amounts of blood, then yes, you need to get evaluated. Or if there is any sudden change in voice, or you have a severe chest pain which is persistent for longer time, and you have a difficulty in breathing, or you are unable to breathe properly after doing some work or walking for a longer distances, so yes, you need to get evaluated for lung cancer. Next one. So gastroesophageal cancer, that is the gastric cancers, generally usually present with difficulty in swallowing and recurrent indigestion or persistent gastric, what we call as the gastritis, or there is a retrosternal pain which is not going out, or you feel that you eat a little bit of a food, not the lesser quantity than what you normally eat, and you still feel that your stomach is full, or you're unable to you're not having an appetite, you always feel that you're full and you don't want to eat. If these are the changes which are occurring suddenly, yes, then you need to get evaluated for these also. The next one. The colorectal, that is the intestinal cancers, usually present with what I was saying about the change in bowel habits, or they may present with blood in your stools, or feeling of bloating sensation, and they may also present with constipation. Next one. Prostate cancer, most common. This is the cancer of men actually, but yes, you may have some men in your home. Even though this is a women's college, I would like to speak about prostate cancer also, because this is most commonly seen in elderly individuals, and they usually present with trouble in urinating, or presence of blood in urine, or blood in the semen, or there is a decreased force in the stream of the urine. They have a discomfort in the pelvic region because it usually affects the bones. There can be bone pain, and there can be erectile dysfunction also. Next one. Bladder cancer also may present with the blood or blood clots in the urine. There may be pain during urination, or the burning sensation and dysuria, or urinating small amounts very frequently, and there may be a recurrent urinary tract infections also. Next one. So breast cancer I didn't put up because the most common symptoms of breast cancer are presence of a lump in the breast. So that is what we commonly know, and that is what we need to get tested anytime you notice any lump in the breast. So we can prevent this cancer. Next one. Though there are so many bad symptoms which we are discussing, yes, we have a good news that we can prevent the cancer. But when we ask anyone, we try to say that don't tell me if I have a cancer or not. This is what the common answer we get from them. No one wants to know if they have it or do not have it. They just don't tell me that I have a cancer. So next one. So how can we prevent it? Avoid the tobacco products, cigarettes, everything. All the tobacco products should be avoided. Next one. Less alcohol, the lower cancer risk. So I've been saying that whatever the causes are there, we try to avoid the causes like smoking, alcohol. Next one. Regular exercising to maintain a physical fitness, which is associated with decreased cancer incidence. Next one. Obesity and body weight. Yes, we need to reduce obesity. It's not just for looking good, but also it has a very good effect on your health, especially decreasing the cardiovascular risk, decreasing cancer risk, decreasing your diabetic and hypertension risk. So yes, maintaining a proper body weight. I won't say you have to become lean or maintain a size 0, but yes, maintaining a correct body weight helps in maintaining a good health and decreasing various ailments. Next one. And decreasing the fat. This is what I was saying. Next one. So French fries are also called as cancer fries in our oncology community because they're fried at a very high temperatures, and they have various cancerogens, especially the acrylic amides which occur during the frying process can also affect the GI tract, that is the stomach and the intestines, leading to cancers. Next one. And food additives, we know we buy so many products from outside, but never we go through the ingredients list which is present on the back of the boxes, especially for the products, ready to eat products, and all the food products which we are buying from the supermarkets. If you go through the list of the ingredients, you find so many things which you don't know. They put on the code numbers and all. Out of this, many are associated with the increased risk of developing cancers, especially the additives which are added to the foods to maintain, to give us a color or to increase the shelf life or give us a different taste. So these additives have a higher risk of developing cancers. Next one. So this is a comic which is very popular. If we see the food products honestly, if they are labeled, we can see that we have a heart disease related bread spread, we have the acrylamide chips, we have zero nutrition puffs, we have colon cancer causing dogs, not the hot dogs, but the colon cancer causing dogs. So yes, if they are labeled correctly with the based on the additives which they have, they are almost related to various diseases. That's why it's always better to have a food which is freshly prepared and eaten immediately rather than storing or buying the products which have a longer shelf life and which are ready to eat. Next one. So what are the food products which we have to eat? We have to eat the high content fiber products. This includes various vegetables and eggs. And it's not only vegetables and eggs, but also the non-vegetarian food also is good in proteins and good fatty acids also. Next one. So we can increase the fiber content by increasing the salads and eating the raw vegetables, which can be eaten raw, not all the vegetables. So how does this help us? This will help in improving the movement of the potential carcinogens from the intestines outside. They are digested early and they are removed from the body early if we have more fiber content in the food. And they'll also increase the bile acid absorption, which helps in removing the other carcinogenic products which are present in the intestines. Next one. So for increasing the fiber content, we have to eat more raw vegetables and raw fruits. These phytochemicals in these raw vegetables support the body's immune system, and they also have various antioxidant properties. And fruits and vegetables also alkalize the body. Next one. And yes, even we have to change our oils. We have to avoid the oils which are high in saturated fatty acids. It's better if we go with olive oil or sunflower or a walnut oil, which have a monosaturated fatty acids, which are good for health and help in decreasing not only cancer risk, but also the cardiovascular risk also. Next one. And yes, green tea is also good for health because it is known to have very good antioxidant properties. And this will help in decreasing the oxidants in our body, which result in damage to various tissues in the body. Next one. And so water is never low. It's always the best thing which we can have, and this is the easiest available thing which we can do. At least drinking 3 to 4 liters of water per day will keep lot of diseases away. It's not an apple a day keeps a doctor away, but the water actually keeps most of the doctors away if you can have at least 3 to 4 liters of the water per day. Next one. And I was saying about the alkalinity maintained by the vegetables and fruits. This is important because when the body content is more acidic, there are more chances of developing various diseases like arthritis, diabetes, hypertension, obesity, cancers, and all. So if your body is in the alkaline state, then chances of these diseases developing is very, very low. So how do we maintain alkalinity? We generally have to consume more raw foods and fiber content foods. And we have to abstain from the acidic foods, and especially the sodas and the cool drinks which are more of acidic content rather than, and this can affect the body in the long run. Next one. And yes, one more thing which we have to do is we have to go for regular checkups, regular clinical examinations, and in case of symptoms, don't ignore and don't wait. It's as soon as you find any doubt, it's better to consult rather than waiting and consulting. Next one. So other than this, avoiding the causative factors of cancer, the thing which we can do and which doctors can help you out is with vaccination. The vaccines which are available to prevent cancers are the HPV vaccine and the HBV vaccine, that is the hepatitis B vaccine. Next one. So HPV is the virus, human papilloma virus, which is associated with the development of cervical cancers. And HPV vaccination is shown in various studies to prevent the development of cervical cancers. Next one. So these are the 3 HPV vaccines available in India at present: the Cervarix, the Gardasil, and the Gardasil 9. Next one. So these vaccines are 100% protective against infection with the human papilloma virus for those people who are not infected prior to vaccination. And it also has 99 to 100% efficacy against the genital warts, the vaginal intraepithelial neoplasias, and the vulvar intraepithelial neoplasias. These are nothing but the precursors for the development of cancers. And for those people who are already infected with the papilloma virus, the vaccines are still efficacious in preventing the development of cancers. Next one. So how is this vaccine given? This is given as a 0.5 ml dose in the deltoid or in the anterior thigh. And it is given as 3 doses, 0, 1, and 6 months for all those individuals who are more than 15 years of age. If you are less than 15 years, that is 9 to 14 years of age, only 2 doses are sufficient. The ideal age to receive this vaccine is 11 to 12 years, but yes, anyone can take the vaccine up to 26 years of age, and especially those in whom the sexual activity has not begun. So unmarried women up to 26 years of age can also take this vaccine in 3 doses. Next one. This is because those people who have sexual activity have a higher chance of already acquiring the infection. So then the vaccine efficacy is slightly lower than those people who are not infected. Next one. So are there any side effects with the vaccine? Because now we are seeing even with the COVID vaccine, which is being given for everyone is worried about the side effects. But frankly speaking, there are no serious effects with the vaccine. It may be small, light pain at the injection site that can be seen with any injection. There may be slight swelling and a fever for a day or two. That's it, not more than that. But that is also rare with the HPV vaccines. And the benefits which we have already outweigh the side effects, which are very, very mild. Next one. So the other way to prevent is not only vaccines, but also screening. So screening is something which we do to identify the cancers in the very early stage. I was saying initially that when we have a cancer identified in the early stages, it can be easily cured. So how can we identify the early stages? Generally, it may not be obvious in the early stages. So screening is a method where we identify those patients who might be having cancers, but it is in the very, very early stages of their cancer. So next one. So what are the cancers where screening is approved? In women, the cancers, the most common cancers, that is the breast and cervical cancer, have a screening method to identify them early. And in men, lung cancer, colon cancer, and prostate cancer are the 3 cancers where we have different screening methods to identify those people who are affected early. So in India and in Hyderabad, especially, breast cancer is on high, it's increasing rapidly. So screening is one method where we can identify the breast cancers early. Though the numbers may increase, but we are at least trying to avoid the deaths because of breast cancer because we are identifying it early. Next one. So for oral cancer, though there is no special medical test to identify the oral cancer early, but screening the oral cavity for any lesions, that is, these are all the different sites of the oral cavity where we need to examine to identify if there are any lesions like ulcerations or swellings, lumps, or any other lesions are present, we can identify by getting an oral checkup done. Next one. And coming to breast cancer, this is very important. Breast cancer screening is done with mammography. Mammography is nothing but it's a kind of a X-ray. It is done in within 5 to 10 minutes of time. It doesn't take more than that. And it is reported as a BIRAD scoring system where they'll give the probability of any lumps are present and the probability of those lumps being a cancer. And the other ways of screening breast cancer is self-examination and also getting examined by the doctor. Next one. So this is how breast self-examination is done. Usually it can be done while taking a bath under the shower. You can examine the entire breast should be examined, not a single part. You have to palpate and see everywhere in the breast if you are finding any abnormal lumps. Or you also have to notice if you are finding any abnormal discharge from your nipple, like blood discharge or any whitish discharge which is coming suddenly without any reason. Okay. You have to examine yourself by raising your hands and putting your hands on the hips, and while taking a shower is actually an easier way to examine, or if not, you can lie down and also examine your breast. This is self-examination, which should be at least started from 40 years of age for those people who do not have any familial risk factors. But those individuals who have a family history of breast cancer, the self-examination and mammography should be starting from as early as 25 years of age also. Next one. And coming to the cervical cancer screening, this is done by the PAP test. PAP test is nothing a big test or is not an invasive procedure. We just try to put a very small swab into the cervix and try to just scrape the mucosa you won't feel any pain or anything while taking this graft, because we're just trying to brush around the cervix to get the cells. We're not going to put any injections, or we're not trying to peel off any tissue or anything. We're just trying to use a soft spatula to just brush around the cells to get the cells and examine the cells. Next one. So in this, the new techniques which are available for pap smear testing, that is the liquid cytology. And we are also using a combination of HPV test and the pap smear on the smear collected, and usually done for women 30 years of age or older. Next one. So when do the pap test needs to be done? No later than age 21, or no younger than 21 years should also be not screened. Pap test can be started from done from 21 years of age, and it is usually done every 3 years once. Next one. So it is done every 3 years until the age of 30 years. This is done only with the pap cytology. But after 30 years, the HPV testing is also done along with the cytology. Cytology is nothing but the study of the cells alone. So from 21 to 30 years, we just study the cells. But after 30 years, we also see if there is any human papilloma virus infection associated with the changes in the cells. And if both of the tests are done, then it is done for every 5 years. And if only cytology is being done, we do it every 3 years. Next one. And when is the best time to done? It's better to have it done when you're not having your menstrual periods. And it is also best to obtain from intercourse and avoid use of tampons or douches for 2 days before your pap test done, because this will alter your mucosa, and the test may not be correct when you go for a test during the menstrual cycles. Next one. So whenever we're getting screened and find out any problem, it's better to immediately consult with the proper oncologist for the proper management, not with your quacks or any local doctors or RMPs who are not trained in oncology. They may not give you proper advice, and that may lead to more negligence rather than getting cured. Next one. So as I told initially, I would like to speak about some myths of cancer also. These are all myths and we should not believe in them. Next one. So the common myths, general myths we have heard: we don't need to speak about cancer, we should not speak to anyone. For cancer, there are no signs and symptoms, it will just come off suddenly. Or there is nothing which we can do about cancer if you're diagnosed with it. And I don't have a right to take the treatment for cancer. These are all the myths which are generally seen in public, but this is not true. We can speak about cancer, we can get it cured, we can get it treated. We do have symptoms and signs which can be identified to diagnose it as a cancer. Next one. So these are the questions which you also face. Is cancer a death sentence? Will eating sugar make cancer worse? Or do use of artificial sweeteners result in increased cancer? Is cancer contagious? No, cancer is not contagious. It will not spread in your family. It is not a virus. It affects only the individual who has the cancer. There's nothing that you need to avoid being with them or you isolating them. Nothing is required for cancers. And yes, artificial sweeteners do not cause cancer, but they are not good for your health. And eating sugar does not make your cancer worse. It's just that the obesity is what we need to keep under control. Next one. And we also get some persons when they come to our OPDS and when we ask them to get a biopsy done. Biopsy is nothing but a needle test which to identify what is the type of cancer. We are surprised to listen that they think that the cancer spreads if you do a needle test, but no, cancer does not spread with the needle test or with the surgery. Whatever the doctors are doing is actually trying to give a better life and also to decrease your symptoms and cancer. No one does a procedure to spread your cancers. No one is interested in spreading your cancer outside from the where it is already. So no, biopsy and surgeries do not increase your cancers. And yes, cancer does not get worse with exposure to air. There is nothing you need to isolate or stay away, and it does not spread through air. And will cell phone usage cause cancer? I would say no. We don't have any particular data saying that use of cell phone will cause cancer. But yes, with the newer technologies and all, we may need a longer follow-up. Maybe down the line, 15 to 20 years, we would know what the 4G and 5G effects are going to be on the human body. Next one. And deodorants and hair dyes, the common suspects of cancer. There is no proof that these are causing cancers. Next one. And are there any herbal products that can cure cancer? No. There is no scientific evidence that any herbal product is going to cure your cancers. Whatever evidence which we have is for the allopathic medicines we have and the surgeries we have, that they can help in reducing and curing the cancer. Next one. And the same familial thing which I was speaking prior. Next one. So these are some of the common breast cancer myths which you see. We think that young people will not get breast cancer. Men are not affected with breast. Alcohol does not affect your breast cancers. And only those who have family history may develop breast cancer. No, these are all false. Even men can develop breast cancers, and women less than 30 years. The youngest female breast cancer patient we have is around 21 years of age. So yes, even young people can get it. Alcohol increases the risk of breast cancer, and all women are risk. The being a woman is actually a risk factor for breast cancer. Even if you have it or don't have it in your families, you are at a risk of developing breast cancer. And yes, women who do not have children or who do not breastfeed wantedly are at a risk of or increased risk of developing breast cancer than those women who breastfeed the children. Next one. So these are the myths about lung cancer. There is no immediate benefit of quitting smoking if you are already smoking for many years. No, it's not true. Quitting at any time is always beneficial. For those persons who keep on smoking have a higher risk of cancers than those persons who quit smoking at any point of time. And using pipes and cigars are no different from using the normal cigarettes. Electronic cigars are also not good. They are also bad as the normal cigarettes. And is smoking the only cause of lung cancer? No. Lung cancer can also occur in non-smokers, or those people who are never exposed to smoking also can develop lung cancer. Next one. And these are some facts and myths about the brain tumors, that the benign tumors are not bad. They do not come back. No, benign tumors can also come back. And if a brain tumor is there, it doesn't mean the end of life. The symptoms are also depends on the site of the tumor rather than whether it is a benign tumor or a malignant tumor. Next one. So cancers in children, we have childhood cancer is also a common one, though not seen outside in the public. But yes, many children are affected with cancers. And the survivors of childhood cancer are not carriers of the disease. They don't spread the cancers to their offsprings or do not spread it to their family members. And all survivors are genetically inferior and have fertility problems is a completely wrong notion. Those patients who are survivors of childhood cancers can have an absolutely normal life, and they can have the as long life as other people, and the risk of developing other cancers is same as the other general population. Next one. So you don't have to be afraid of cancer anymore. Next one. Next one. So next, please. Yeah. So cancer is curable now. However, it is not cured with just medicines or drugs. It's cured with knowledge, identifying it early. It is awareness among the public which will make cancer curable. Next one. So if diagnosed now, till now we are speaking about all the diagnoses, what are the causes, symptoms, and how can we prevent it. But even if you're diagnosed also, we have these many options for treating cancers. We can go with surgery. We can give radiation therapy wherever required. We have chemotherapy. We have targeted therapy and hormonal therapy. And we also have the immunotherapy which has come up. And these all therapies are based on the tumors, the stage of the cancers, the type of the cancer available, and what best suits the patient. It's an individual treatment. It's not a common treatment for everyone. We should not think that okay, this person has this cancer and they have received chemotherapy, so yes, I should receive chemotherapy. It is not like that. It is the individualized treatment. For each individual is separate. Some may require surgery, some may require chemotherapy, some may not require any chemotherapy or radiotherapy. They just make cure with the surgeries. So yes, it's different for different individuals. Next one. So chemotherapy is nothing but the use of anti-neoplastic drugs, and these drugs generally go and kill directly the tumor cells. There may be some side effects because of their effect on the normal cells, but yes, the majority of action is on the tumor cells only. So in order to decrease these side effects, the newer therapies like the immunotherapy and targeted therapy are coming up. These directly act on the tumor cells only. Their effect on the side surrounding cells or the normal cells is very less. So the side effects with the targeted therapies and immunotherapy is comparatively lower than the chemotherapy. Next one. So I would like to conclude by saying the three important take-home messages for today. Cancer is preventable, and you can prevent it by improving your lifestyle and diet. Cancer is curable if detected early and treated promptly. And cancer can be treated at next one. Next slide, please. Next one, please. Yeah, so be alert, be vigilant, and save your life and also save the lives of the people around you. So, yeah. Any questions, please?
Thank you, ma'am, for such an excellent presentation. So we are having two questions, ma'am.
Thank you. Yes, please.
Ma'am, one question is from Pravani.
Mm-hmm.
One question
Yes.
is from Shravan Kadam. He is asking that can cancer transfer from breastfeeding mother to offspring? There is a genetic link.
No, from breastfeeding mother to offspring, it will not spread. It is not any virus or any drug. It will not spread. The cancer cells won't move from the breast milk to the offspring. If the mother, in the mother, if the breast cancer genes are there, that is, the BRCA genes are present in the mother, then we need to test for the child once they are of at least 16 to 18 years of age. We have to see if they also carry the same genes. Then yes, they may have a chance of developing the cancer, but it is not transmitted to the breast milk.
Okay, ma'am. Ma'am, one more question from Pravani. She is asking why the cancer patient loses their hair. Why there is a hair loss.
The hair loss is mainly because of chemotherapy. So as I was saying, chemotherapy not only acts on the tumor cells, it will also act on the normal cells. So the cells which are mostly affected by chemotherapy are those cells which have a high proliferation, that is, which keep rapidly growing. So our hair is one part of the body which keeps rapidly increasing daily. So they are more affected by chemotherapy, hence the hair loss occurs.
Okay, ma'am. Thank you, ma'am, for such an excellent presentation, ma'am.
Thank
And
you.
um, thank you, ma'am, for accepting our invitation and sharing with us your time, experience, and enormous knowledge, ma'am.
Thank you again.
So, ma'am, you have presented in such an interesting way that you have made this session more memorable, and we are honored to hear you, ma'am. Thank you so much, ma'am. Thank you, ma'am.
My pleasure. Thank you.
Thank you, everyone, for joining us for today's webinar.